Okay, super. So we're going to talk to you a little bit today about the work that we've been doing with large global networks during the course of the pandemic. You may or may not have heard of the term EpiWin, which was a name that we invented kind of on the spur of the moment, and it stands for the WHO Information Network for Epidemics. And the primary objective of, as you can see from the name, was that we wanted to reach networks with accurate information. That was how we started at the very beginning of the COVID pandemic. This engagement has evolved quite a lot over the course of the pandemic, and we want to share with you today some of that evolution and where we've got to. So I think very important for us is to state up front the guiding principles of our engagement that have developed over time. Like I said, we started the engagement very much with an information needs to go out type of approach. And as we have continued to work with these large global networks, we've learnt through them and through each other as well, the way that we want to work with these networks. And so you see on the slide that the guiding principles are really based around things like partnerships, acknowledging that everybody has a different role to play and something different to bring to the table. We really value listening to a dialogue. So it's a very equal relationship between WHO and these networks. Again, the respect that goes with that, and a core principle of making sure that trust is at the center of these relationships. And then, of course, the communication, the open, transparent communication, and making sure that we can be adaptive, which is, of course, incredibly important, as everybody knows, in a public health emergency. So why do we want to work with networks? We use the word network and community rather interchangeably. Networks can be global, they can be regional, and they can be local. And so it really is a way to reach down into local communities. We also know that that during times of crisis, there can often be a bit of a trust crisis. And so many times people will turn to their community or network leader for support and for information and for guidance. And so supporting these community leaders and network leaders is a very important part of our work. And also because the large global networks that we engage with, and I'll speak a little bit about them on subsequent slides, include large populations of the world. We engage with the faith network, we engage with what we call the world of work, and we engage with youth networks. And so the majority of people in the world in some way affiliate with one of those large networks. So that is one of the reasons why we want to work with these networks. I'm not going to go into every detail in every slide. There's a lot of content in our presentation, but the slides will be shared later. So if there is anything that you wanted to go into a bit more deeply, then please do ask a question at the end, or of course, we'll share the slides. And then, so this is, like I said, the networks that we engage with, the faith, the youth, the health and the world of work. And then there's a fourth one that has been probably the newest group that we've engaged with. And this is a large community that is involved in science communication or science translation. And then the last two buckets on this slide are some of the other activities that we do to support this engagement. And we'll go a little bit more into detail on what those actually mean, but there is the science translation. And then there is an interesting new project, which is a digital solution to support our work, and that is the Hive platform. So I'm going to hand over to Sally now, who's going to speak briefly about our methodology. So over to you, Sally.
Thanks very much, Sarah. And just to say, just building on what Sarah's just said, really, our methodology is to engage the partners that we have already engaged with and try and have a sort of snowball methodology to reach out and engage more through those partners, so that we'll be strengthening collaboration with global networks in emergency preparedness and response. And again, recognizing that many of these communities are involved in with their local communities all the time. They're there well before a pandemic emerges. They're trusted, and they've already been working in community development, resilience, education, health provision already. So we want to recognize that in order to have a whole of society approach, we need diverse representation. We need to bring in communities of different types. And particularly working with the faith community, that also means of different faiths and people from Indigenous communities, for example. One of the ways we do that is to convene those networks. They already have, many of them, existing networks through which they communicate with one another and work on other projects. And there's well-recognized leaders within many of those networks and communities. And so we engage with them so that their decision makers can access trusted information and share best practices. We've had requests from a number of the communities for us to ask one of our technical experts to provide a technical briefing, for example, on vaccines, so that then they can take that information and adapt it to their own community, and then they can lead webinars or put out statements, for example. We then work in co-creation, and I think it's become very clear that if you just provide a bit of information to people, and if they don't engage with it, if they don't believe in it, if they don't own it, then it's very difficult for them to pass it on. Whereas if you engage in that community and helping to develop the material in the first place, then they have that sense of ownership, and they're much more committed and engaged in moving it forward through their own community. And I think then that builds into number 4, which is engaging those communities then in sharing that accurate information. And as trusted members of that community, that then builds that resilience to misinformation within the community. So it's a kind of circular process that builds one layer, builds on the next. Go to the next slide, please. So again, just to repeat, it's a whole of society approach. We don't touch every single part of society. We can't possibly do so. We're a small team, but by that kind of snowball methodology, it can reach a larger number of people than we ever would on our own. And the next one. So the 4 communities that we work with particularly, I focus on the faith group, but we have other colleagues in the team who spoke to the cohort this morning who work with youth and health, the world of work and science. But particularly with the faith community, we've been engaging with traditional partners that WHO and other UN colleagues have worked with for many years in HIV and Ebola and leprosy, MCH, maternal and child health, for example. So there's already a relationship there to build on. And they have different roles in society. They run hospitals and they run education facilities. In the pandemic, they've also made their houses of worship available to local district health offices to provide either feeding programs or as vaccination centres, for example. So they're very diverse and engage in both the preparedness and the response in many different levels. Youth are very important, as we all recognise. They're the future leaders. And as we work with the youth community, it's exciting to see them grow and develop and take on that leadership. As we pass on some of the experience we've had, they've got new ideas and they can take that forward in ways that some of the ones like me, who are very old, aren't able to do. The health in the world of work has again been a relatively new engagement. We're working with employers and businesses who've been particularly hard hit by this pandemic and enabling them to work with their employees and provide essential and important, accurate information to them. And the science communication, I think we'll talk a little bit more about later, but particularly taking the scientific information and finding ways to present it to communities in ways that they can understand. The next slide, please. So in order to do that, we convene the networks and then work with them to share the best practices. The next slide, please. I think over to Sarah.
Yeah, thanks. So this is the second part of the methodology that we shared, and that's the convening of networks. We're just going to go through a couple of quick case studies for you to really conceptualize what we're talking about. This is one from the world of work where we convened these diverse stakeholders in a series of closed dialogues, and we had government officials and we had labor union representatives and we had people from the International Association of Employers, for example, and they came and they talked about topics that were really putting health at the center of the conversation in the pandemic. And we co-created this report, which had a series of recommendations that could be taken forward by the sector. And I think what was so important was to be able to use WHO's neutral convening power to be able to put health at the center of that conversation. And normally a forum that might be quite competitive and might have significant other interests beyond health at the forefront of their concerns. And it was a really wonderful example of dialogue and shared learning. The second case study is on the science translation. So I think it came out of the World Health Assembly. There was a resolution that urged our countries to take measures to strengthen health literacy and counter misinformation, disinformation, and stigmatization. So the team here at WHO worked to convene a diverse group from around the world of people, influencers, communicators, medical health professionals, journalists, whose ambition or passion or job it was to translate science for a broader population. And that was this is the first time I think that WHO has done something on that scale, on that subject. And they developed a sort of area of work that they will take forward into next year. Sally's going to, I think, talk about the third methodology, which is the co-creation. So over to you, Sally.
Thanks very much. So again, for this one, we've taken a focus on the faith partners. We've got case studies for each of the different communities under each of these different headings, but we've just really picked a selection of them for you today. So I've worked mostly on this faith partnership. And the first thing that the team did was to work on the bottom bullet, in fact, practical considerations and recommendations for religious leaders and faith-based communities in the context of COVID-19. Those bullets there in turquoise are actually the links to the document. So when you get the PowerPoint later, you'll be able to go and see it on the website. But it was important to build on the work we've done in Ebola, where we worked together to adapt the dead body management protocol that had been developed for Ebola into a safe and dignified burial protocol, which recognized the religious and spiritual needs of communities to actually respect and honor their dead, whilst at the same time having to take certain measures to prevent infection spreading during the Ebola pandemic. And we had already a network of people that had been involved in that. And so that network was reconvened and were able to then help us to think through how the advice for religious communities in the context of COVID could be put forward to religious communities in ways that they would accept. Then we moved on with that group to broaden and strengthen the group to bring in a broader number of faith partners from different faith traditions and geographic regions. And over the last really 18 months, we've been working on a strategy for engaging religious leaders, faith-based organizations and faith communities in health emergencies, which was launched on the 3rd of November this year. It's a really exciting piece of work for us, but also for the faith communities who've really been looking to WHO for a stronger engagement for a very long time. So for them, this was a very important piece. And it's now going to sit under the umbrella of the FENSA document longer term. And then the third piece we've worked on is a whole range of, we convened 3 communities of practice from these multi-faith organizations to look at 3 different areas of work. We had one community of practice on communications around vaccines and accurate information. We had one community of practice on learning and research. And we had a third community of practice looking at and get models of engagement under the framework. And so following that, we worked with these communities of practice to develop a series of webinars that was clustered together into a conference, which is just finished today, actually, with the last session. We had 3 thematic tracks and we had 10 sessions, and they're all on the website if any of you are interested to listen. But it's been a very rich time of learning and listening from many of our faith partners. I know less about the youth products, and I know that Catherine spoke to you this morning. Sarah can add, but the youth project's been really exciting. We've had the design lab was inviting contributions from the young people of initiatives that they'd like to see, and there was a competition, and some of those were actually turned into messages that could be used much wider. There's also a joint research study engaging the young people in research in issues around COVID that really interested them. Sorry, I can't talk much more about the details of that, but we can answer questions about that later. Thanks very much.
So I think the fourth, you did it very well, Sally, so that's fine. So the fourth methodology is the methodology of engaging. And I think this really has, as Sally mentioned when she talked through those four methodologies earlier, they're all quite interlinked. And some of the previous case studies and activities that we talked about really, this building resiliency to misinformation is a key part of that anyway. So there is this, again, from the Faith Community Network, and I'll give it back to Sally because I think this is really where Sally led. So over to you, Sally.
Yeah, sorry. This has been an exciting piece again, because as I mentioned earlier, we had requests from some of our faith partners to bring in the senior sort of technical staff from WHO to provide technical briefings. And at the very early stages of the pandemic, back in November of 2020, we had a request from the Anglican Communion in the UK, who have a worldwide network of bishops and archbishops, for a briefing on the vaccines. We then provided that briefing for all our faith networks. But then that Anglican group turned that into a call for action on vaccines really quite early in the process of vaccines going global, if you like. We also then worked to help some of the partners share that information with their communities. And the second picture there is the SIL network, who made lots of little storybooks on the COVID information, and they produced those in many different languages in very simple English. And they found that they found ways of taking the technical information both into English in a very simple form of language and then translating it into other languages. And we also co-convened groups to help us develop messaging that would meet the needs of the different faith partners. So it was looking at different ways of developing the messages, adapting the messages, and enabling people to take and adapt them themselves while keeping the technical content accurate.
Thanks, Sally. And I'll just quickly go through the last two or three slides because I know we won't have time for questions, but we've talked through the four methodologies, and then I just wanted to briefly mention the science translation work. So this is one of the first activities that we started right back in January of 2020. We started to develop easy to understand slide sets on technical subjects related to COVID that have been shared early on. I mean, it was almost every week they were going out, and then we moved to a bi-weekly set, and then, as current topics become important, we adapt those. We've also done hundreds of EpiWin webinars over the course of the pandemic, trying to bring information to a broader swath of people. And then I just briefly mentioned the Hive platform. So again, this is like I mentioned earlier, it's been 18 months actually of research and planning and prototype building, but it's basically a digital platform that we hope to launch early next year, which is a place that our networks can come to share information, to collaborate, and also to access trustworthy information. So we'd be really happy to provide you with updates on that going forward. So our three key messages before we end and we answer some of your questions are, the first is really WHO's mandate is to promote health, keep the world safe and serve the vulnerable, but we can't do this without working with nations, partners and people, and EpiWin really seeks to do this through the engagement with networks. And the networks really are big communities, and that are convened around either a common history, common values, objectives, etc. And so by acknowledging that, we acknowledge that each network brings something different to the table and to emergency preparedness and response. And then, of course, most important is that this trust, partnerships and capacities and systems have to be built before a crisis, and they have to be sustained and nurtured. It's not something that we can build during a crisis and then leave to stagnate when things are relatively calm. So thanks, Tina and team, for the opportunity to present, and we'd be really happy to answer any questions if there are any.